Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and I'm joined today by Mayor Tom McNamara. So today we're going to talk a little bit about the Abbott Binax Now antigen testing, another tool for early identification of cases. Last week we pushed out information to partners in the community regarding the availability of the test through the health department. We received our initial shipment of approximately 5,000 test kits, and oftentimes you'll hear this referred to as the card test. It is an antigen test, and it is one type of viral test that's being done out there. Of course, we have been very familiar with the RT-PCR, which we call the gold standard. This is the one that's done at our two testing sites on Racton Avenue at the University of Illinois Health Sciences campus. But this test also requires a nasal swab. And it received emergency use authorization through the FDA, but it provides results within 15 minutes. And one of the challenges or activities that we think this will be very helpful for, especially is in the school arena with early exclusions. Remember, one symptom keeps a staff member, a student out of the classroom environment. And this will allow those entities that choose to participate to be able to identify rapidly a potential case within that, so we can take the first steps to isolate and then quarantine the close contacts, rather than waiting for 2 or 3 days before a test can be done and the results come back. And as we do more testing in the state, we know the turnaround starts to increase. So this is another opportunity, another tool. It is not a perfect tool. It can't be, typically isn't used for surveillance because it's an antigen test. It really detects really kind of a different mechanism for looking at does our individual have the disease. It has a high positive predictive value in symptomatic, if you're a contact to a case with symptoms, and when you have a high rate of infection in the community. So this is a testing methodology that has a great potential in our community at this time. For the entities that are participating, just so you know, this isn't a do-it-yourself test kit. This is not something that you can just pull off the shelf. While it's what we call waived or not complex in terms of medical speaking, in terms of complexity in the what we call the clinical lab improvement amendment. It is not a home administered kit. It's a waived test, so it's simple to perform in an office. And Winnebago County Health Department is working with its partners to extend its CLIA waiver to entities without medical directors and or typical CLIA type licenses, which you typically are seeing in medical clinics. So schools don't typically have those. Workplaces typically don't have these. So we are working to extend our CLIA waiver and perform these tests under standing orders. It does require physician order and healthcare personnel to conduct the test and interpret the results. And while it is considered a waived test or simple to perform, it still requires the healthcare provider who is administering the test to wear PPE, including an N95 mask, face shield and goggles, gloves, and gowns. And why? Because they are taking active live specimen from the nasal passages. And it does require biohazardous waste disposal capability. So for those of you who've been thinking about the home test and how easy this will be, this is definitely a test that still needs to be done under controlled circumstances. So we've outreached to provide our CLIA waiver and the standing order to test for schools, K through 12, universities, first responders, daycares, critical infrastructure, including water, utilities, waste disposal, federally qualified health centers, drug treatment, homeless shelters, and our developmental disability homes not covered through long-term care facilities. Our long-term care facilities are also receiving test kits through what we call HHS or the CMS Centers for Medicare and Medicaid so that they can provide those as well. These tests will be provided at no cost to individuals who are tested. Positive results will be reported through what's called the INED system and will be followed up by a case investigator and contact tracer. So these will be handled like any other positive testing in that scenario. However, when the test is negative, it may require confirmatory testing using the RT-PCR, given our high rates of positive and given the fact that when someone's symptomatic, if it comes back negative, we have a high degree of suspicion that this may be a false negative test and we'll send them on for additional testing. And we will be required to quarantine and isolate as well during that scenario. So each entity in our community is reviewing and considering how to best use this test in their particular environments and whether or not they can have that capability. But it's one more tool as this pandemic progresses on a positive note that we can begin early identification of potential cases in the community. So that leads me to the next step. If you're positive, case investors, contact tracing. So we've been looking at some of the data out of our, what we call the Salesforce system, and frighteningly enough, approximately 30% of individuals with a positive test result do not follow up with a case investigator or contact tracer when they call. And what that tells me is that the case may not be appropriately isolated, close contacts cannot be identified, there cannot be appropriate quarantining of those close contacts, and what that ultimately does is lead to additional exposures and transmission of the illness in the community. So I want to remind the public that all information will be kept confidential. So when you talk to your case investigator and they follow up with your close contacts, they are not going to tell the information or where they got the information. They will simply say you've been exposed and you need to take the necessary steps and actions. Contact tracers, if they need assistance, and an individual may need help talking to their employer or their work environment about that, will work with them to follow the guidance to prevent the transmission in workplaces. So one of the things I'm going to tell you is to answer the phone. This phone number that you will see is area code 312-777-1999. 312-777-1999. If you call that number back, as you see it flash in and you know everyone's being very cautious about taking robocalls and other things, it will then know which phone you're using to call from. And so it will then go through it, and it will identify that you've called the Illinois Department of Public Health and will route that call back to us. So when you get that call, respond with facts and truth. Our goal is not to be judgmental. Our goal is to protect the rest of the community, protect the close contacts, continue to monitor you if you need hospital care to get you in promptly. You could prevent serious illness, and you could save a life. So please answer the phone call. Let's get our response rate up. And while the health department will be closed for routine business as a governmental entity tomorrow on Election Day, and we encourage everyone who has not yet voted to vote, both of our election authorities are prepared to manage you with safe social distancing with face coverings on. The COVID-19 team will be working to continue their case investigation, contact tracing, and daily data reporting. So they will be working tomorrow. So pick up that phone if you see 312-777-1999. So as we heard over the weekend and as we come into today, all the regions in the state are now under some form of mitigation. And of course, Region 1 continues under what we call the next level of Tier 2 mitigations. We need the cooperation of the community to decrease the transmission. You need to wear your face coverings. Please stay home when you're sick. And while we're not going to talk about individuals, the number of individuals who go into workplaces or go into school or go into a place saying, I didn't think it was COVID for several days during the time frame and expose others unintentionally. Stay home if you are sick. Maintain 6 feet of social distancing with individuals outside of your household. This includes family members who do not live with you or close friends who you trust and you think they've been taking all the necessary precautions. It's these small social gatherings that are causing one of the increased risks for the community. We talked about this last week, limiting non-essential travel. So if you're an employer or a business, look at where your workers are going. Is that essential to the work that you're doing? Could you do it remotely? Because right now we have one of the higher transmission rates in the state. And so people need to be thinking about staying put, staying home as much as possible, and limiting their non-essential travel. And then we talk about limiting your contacts, being intentional about those activities outside of the school or workplace. I know it's very easy, and we've talked about this before, about assuming that you acquired an infection from your work, your school, everything but yourself and your family, right? It's easy to think it's outside. But you need to be intentional and thoughtful. It's that dinner party with a household outside of your household. It is the sporting event. It is the game night. It is the games, the pickups that you did not plan on or, plan for. People need to be very intentional. And I know we wish we were all out of this pandemic, but we are not. And we're going to take those necessary steps because this is going to be a long, hard indoor winter if we do not learn how to respect this virus, because it is not done with us. To those of you who go for testing, you need to quarantine until you receive your test results. Do not drive through and then go immediately to your workplace or school and then finish out the week only to find out you have a positive test result. Now, I've heard well, no one said to do that. We've said this multiple times. I know they give the directions out. They give you printed material. Please know that when you are testing, you need to quarantine. Because again, all those days while you're waiting for your test result, and if it comes back positive, all those days ahead are all those contacts potentially that are exposed. So please stay home if you test until you receive your test results. And this seems to be kind of common sense, but we seem to have lost some of this, is avoid potential super spreader type events. So whether that is observing Monday Night Football, whether that is going to a pre-election party or a post-election gathering, please know that those have the potential for being a super spreader event. Anytime that we're gathering large groups of people and we're taking off our face coverings to eat or drink, we raise the bar and we potentially transmit the illness. So new cases for Saturday through Monday, we saw 470. We are averaging 157 per day. Cases were among individuals ages 2 years to 82. We have 3 new locations of concern, and I come back to most of the time, these individuals are not going out, so we're bringing it in, whether we're a family member that wants to visit, or we've got an essential workforce member. That's Alden Deeb's Nursing Home, Carehead Rehab and Health, and Milestone Inc., the Searles ICF campus location. So with that, all that being said, we are now close to 11,500 cases. We are reporting 11,472 cases total since the start of this pandemic. And unfortunately, we're reporting 2 additional deaths. And we talk about this every time. They are 2 lives prematurely lost. And we mourn for their families and with their families for the loss of their loved ones. Our positivity rate is 14.9%. So if you think you're cheating by going to an indoor dining establishment or hanging out with some friends that are not in your household or getting together in groups that are larger than are recommended, you're not. Because our positivity rate is demonstrating that we are not able to slow down that transmission. We are not going down with the supposed mitigations. We are increasing. And while I've heard from the group, our hospitals, look, there's capacity. Again, I come back and remind you, they are explaining that they are also in a fragile standpoint. Because while they can surge up staffing, and the same individuals that are out in the community are also can get exposed is the critical infrastructure and workforce. So while they may have physical beds and rooms, they don't always have the sufficient staff to care for hospitalized individuals. So I come back to trying to use our common sense. I know we're tired. Pandemic's not tired of us. You're not cheating anyone by going out and sneaking an indoor dining event. With a positivity rate of almost 15%, you're putting your community at risk, you're putting all of our businesses at risk. And we've talked about this before, you're putting our children and the schools at risk. They continue to be the guardians at the gate to keep transmissions out of the school environment, but with this much positivity surrounding it, it's very hard. So I remind the public, you're right, we are not going to police ourselves, we can't put up a bunch of rules that you're not going to follow. You need to do the right thing. You need to decide it's time to kind of buckle down, stay put, keep your contacts low, wear your face coverings, and recognize that this pandemic will be something that we will try and get to the other side of. But we are all in this together, and we are all responsible for each other. And so we have to be thoughtful about that. So avoid the super spreader events. As much as you want to cheer your candidates on, do it in a way that's socially responsible. Your community is depending on you to do that. On a positive note, Heritage Woods has worked very hard and been able to stop the transmission within their environment, and they are coming off a community of concern or location of concern, having completed 2 incubation periods. So it can be done, even with high positivity rates. And overall, our recovery rate is 97%. So if you have not voted, please, that is an essential service. You need to go out and you need to vote. Wear your face coverings, maintain social distancing, and then celebrate in your household. So with that, I'm going to turn it over to the mayor.
Thank you, Dr. Martell. I'll begin by just addressing a couple of items I spoke about last week that we had before City Council, and now we have them before, or I'm sorry, let me start over. I'll start by addressing some items that I discussed last week that was at committee. Tonight is City Council. So first and foremost, for all residents of Rockford, you should be happy. We are not increasing property taxes this year. That vote comes before City Council this evening. Second, we know that bars and restaurants have been tremendously impacted. So tonight at City Council, the City of Rockford Aldermen will be taking up the item to rebate 50% of the liquor license fees for all bars and restaurants. If an owner has already paid the annual fee in full, the city will rebate that by 50%. If the owner has only paid the first installment, they will not be required to pay the second installment when they file their renewal application. Third item is we're continuing to work with our state and federal partners to bring more funding into our community to help all of our small businesses. Just last Friday, late last week, the state released just over $750,000 in the city of Rockford for relief for about 41 different businesses. That $750,000 plus dollars is in the form of grants and came through the big grant, which is business improvement grants. We know that many of these businesses are still struggling to keep their doors open, and we also know that a number of businesses were not awarded funding. I will tell you the city has filed for up to $900,000 in a grant from the state that we can provide those dollars immediately to those businesses hardest hit. We've been notified that we have received the grant. We just have not been notified of the amount that we've received and when we'll actually have those dollars. But the second we do, rest assured, business owners, we will make you well aware of that so that we can get those dollars on the streets and into your hands so you can stay open and continue to pay your employees. So as we continue to advocate for that relief, I just want to close with a couple of comments. One is, please, I know so many people have already voted early. Many people will still go to the polls tomorrow. Please show patience. Tremendous amount of volunteerism, polling workers who are there, putting their own health at risk. And you'll probably have to stand outside in many locations, maybe for a little bit longer than normal. But please, show tremendous patience tomorrow as you go and exercise your right to vote. I typically say that now's the time to be vigilant with three things. We're going to add a fourth based on Dr. Martell's statements today. One is make sure that you're wearing your face covering at all times. Whenever you have the opportunity, please wear your face covering. Second, make sure that you're washing your hands. Third, make sure you're practicing social distancing. And the fourth, please cooperate with the investigators and please answer your phone when the health department calls. This is all for contact tracing. This is absolutely critical so that we can slow the spread of this deadly virus in our community. With that, I think we'll open up for questions.
Obviously, the election results parties and your caution there. I guess for people to understand, is that something that I guess the health department will be monitoring tomorrow? Is there anything on your radar? And I guess do you anticipate potential citations, I guess, for those types of potential gatherings?
So the question is, given the discussion, will we be enforcing, will we be out monitoring, issuing citations? So we will be following our routine procedures, which is the notice of non-compliance, the order to disperse, and then an order of closure. I think you're very much aware, if you go to our website, that we have issued multiple orders to close on several establishments. Again, with the concept that we are moving that forward, we report those both to the Attorney General's office, along with our state's attorney, the Illinois Department of Public Health, Legal Counsel, and the DCOE. We feel that those businesses that are not complying with the executive order should not be eligible for the business interruption grants first. And I think that's an extremely important concept. Those are designed to support those businesses that have had to shut down. So if you've not shut down, then I think that becomes an eligibility consideration right away. But we are moving that through that process, using the tools that we have available to us as the local health department.
And I guess going off on that, talking about the notices of closure, it's come across our attention. There's a kind of a campaign rally, if you will, tonight at a business that had multiple of those notices of closure. The advertisement says, first 100 people, that there's a food, giveaway, things like that. I guess if you can, comment on that, and I guess your comment for those maybe considering.
So the question is about a widely publicized event that even came to us, right? And I come back to, and first of all, you're not cheating the virus, right? Remaining open during all of this simply puts more individuals at risk, potentially the elected officials that you're going to include in those. And I come back to their critical infrastructure. They make sure that we are moving and operating as a community, as a city, as a particular, and so for them to expose themselves and allow them to be exposed is concerning to me. The second part, I come back, if there's no demand for indoor, then these businesses would not stay open. And so when I see the number of closures that are coming across because there's indoor dining, I've said to the public before, if you don't go in and request indoor dining, they don't need to provide it, and they won't feel the need to do that. Continue the curbside, continue to purchase gift cards. We understand this is a critically difficult time, but I also want to come back and say our leaders need to lead by example. And I implore them and plead with them to do the same, because I'm getting a lot of cries from our community about that they're very concerned about this kind of event spreading the infection further into the community. So all I can ask is to do the right thing, because it's the right thing to do. And come back, we all have a part in this.
You spoke about the elected officials there, with their potentially being at least looking at the advertisement for this, the county sheriff, the Loves Park mayor potentially in attendance. Are there concerns there with that as far as, especially moving forward with these notice of closures, enforcement, things like that, if that's kind of, I guess, the tone that's being set?
So the question is, are we concerned about the tone? Absolutely. We've said from the start of this that it requires a civil and just society. It is, extremely disconcerting that our leadership, I understand that, I think you've heard us say the disproportionate impact on bars and restaurants and the work that we're doing to try and mitigate that. And at the same time, we need our leaders to stand up and do a positive in the right direction. And so I'm concerned that, simply even allowing an event to be endorsed where it's in violation of the executive order sets a very poor tone for a just and civil society.
I think more so just maybe for us to be able to clarify, we had a mother reach out to us who has a child with disabilities, and, cloth mask or a tighter mask doesn't work, was told that, face shield was okay, and went to a local library and was told that the face shield was not appropriate. So if you can maybe clarify, or if there's maybe a best practice for masks for, I guess, children of that
Sure.
age.
There's a question regarding face coverings or masks for children or adults with disabilities, and we've said a face shield. We talk about the hierarchy of face coverings. So today you heard about people performing the test needing an N95. So, that kind of being the highest level. Then we talk about the cloth face covering and then a face shield. And of course, you can put a face shield over a cloth and you get some additional advantage. But for a child or an adult who cannot tolerate a cloth face covering, a face shield should be an appropriate device. We use those in the schools as well. I'm not sure, we have not issued guidance that that's not appropriate, so I think sometimes it's a communication that we just need to clear up with that particular library and that particular family to understand what is the concern that's being expressed.
Dr. Martell, you talk a lot about contact tracing today and how important it is for these people to answer the phone. Are you guys experiencing challenges reaching out to these people to get them informed about where they stand?
And the question is, are there challenges with reaching out to individuals? Well, I'm going to be honest with you, as a health department, it's never been a surprise to us because we do communicable disease investigations on a regular basis. But given the amount and concern that we have, that people know that they're ill, that they may be exposing others, that, their family members need to be quarantined if they or isolated, at that particular moment, we are finding it a challenge. I mean, we've had several people call us back and say, well, no one called me and I was positive 2 weeks ago. Well, I come back to, you're right, I don't know where that test result went and we're going to have to figure that out, but you knew the right thing to do, which was you could call us, you could say, I got a positive test result, no one's called me, is there anything I need to be doing differently? And we will work with you. And I want to come back to, it's the cooperation and collaboration. We're in partnership. And if we're going to get ourselves through this pandemic and back to our lives and livelihood, no matter if we're talking about testing or vaccinations or quarantine or isolation, we need to be pulling in the same direction and realize that we both have a responsibility. I'll do my best on my part in the health department's side, but I also need the public to do their side as well.
Is it more people conducting the contact tracing that might help on your end? I mean, obviously you're asking for the public to hold up their end of the bargain, but do you guys think you may need more contact tracers, or is that not part of the equation?
The question is, do we need more contact tracers? So we are in the process of hiring up to our 51. In terms of, we've got about 30 that have come on the 51, and we've trained up those individuals. And we've said before, we surge up as well with volunteers that support us in this effort. But when I find out that people, there's been a first call attempt and no one's returned the call, that tells me we're making the calls, but people are not following up on the calls. And I come back to, and I know this seems like a very difficult time, we're not here to judge your behavior. We're here to find out what the behavior was that put you at risk, see if we can't prevent it, and protect others. That's our goal.
You talked a little bit about super spreader events, stuff like the election and stuff, but also Halloween brought a lot of people out of their homes. Do you guys expect to see any surge or side effects from that?
The question is, do we expect to see surges after the Halloween event? Well, I was just talking, the mayor and I were talking beforehand. I had a total of 0 trick-or-treaters at my house. I had to bring in the candy from the driveway. I think that people really monitored their behavior over the Halloween holidays. I'm going to say among children and trick-or-treaters in my neighborhood. And I know the mayor shared in his neighborhood, the number was significantly less. And again, people maintaining social distancing, following the guidance. I think there was a lot of creativity going on with shoots on second floors and candy coming down all kinds of trails and things to make it fun for the children in our community. But I suspect that there probably were some adult events that occurred. And I'm sure that if there is spreading from that, we will expect to see that within the 2-week period following it.
As for new testing, how soon will it be available in the schools?
The question is, how soon will the new testing, the antigen testing? Well, first of all, the kits are here. As anything comes up on a pandemic, it happens very quickly. We got the guidance out on Friday. We've had the standing order, the MOA. Remember, this requires you still to apply for a CLIA license, right? So the schools have to get through their procedures and policies with their boards. Then the next part is, setting up the testing capabilities within their school environment so they can do that if they choose to do that. And then again, making sure that they have the necessary training. Our goal is to get this in there as quickly as possible. When we talk about it being what we call a waived test, is that for those of us who remember, it's a card test. So, it results within 15 minutes. They don't need a machine. So our goal is to get this as quickly as possible, especially on the school exclusion, so that we are not having to send every child and teacher and staff member through the drive-through, testing that takes maybe 4 to 5 days to get results at this time.
I have one follow-up for you. Just generally saw a lot of emotions when we're talking about some of these election night events. Is there anything that you want to say or comment on about some of these events that might be going on in our community?
Oh, I would say, sorry, the question is regarding election night events and campaign-related events. So I absolutely love campaigns. I firsthand understand the amount of work, time, energy, resources, volunteers that go into any campaign. And I also understand if you're a Republican or Democrat, you want to celebrate all that work with people who have helped you along the way. I get that. There's nothing better than those celebrations with people you've worked so hard with. My thing is, I would urge anyone, Republican, Democrat, any party that they're part of, don't have a public event right now. If you're going to have a very small event with your close staff and your team that's socially distanced, that you can wear your face covering. The event you're referencing is, I believe it's Representative John Cabello's event. I'm just going to be honest, it lacks logic. If you look at, quite a few things that he does lacks logic to me. The fact that he didn't support the casino, he didn't support the Capitol bill, he doesn't support our airport, all of that lacks logic. What he did right when the pandemic started by going around to bars as if it was like senior night in college lacked logic to me. And so it's not surprising. I just wish we would have learned something by now that we're at, darn near 15% positivity with not seeing any decline in our sites. We need to drop down our positivity rate so that our businesses can reopen. If you agree with the current mitigations or not, it is what it is. And so we know what it is. And someone once told me, when you know better, you do better. So we know better. So we need to do better. And he, as an elected leader, needs to do better.
I have one last question for you. Obviously, we've learned a lot since March about the COVID-19 virus and how it spreads and such. Is there any inclination as to how that curve, how long it takes for that to take effect as to mitigations reducing some of these positivity rates?
So the question is, based on past experience, what is our understanding of how long does it take for mitigations to have an impact? Well, when you looked at other regions, and of course I come back to Region 4, which is the St. Louis metro region, and then it was, I want to say, Will County and Kankakee counties, correct? It took them about, first of all, it took over a month for Region 4, and they're back in again. And it took a month for Kankakee and Will. But I come back to, it was a different time of the year, right? We were in summer. People could still dine outdoors comfortably. We are now moving into the indoor season, especially in the northern part of the state. And I think that that's going to create additional challenge. I also, have concerns that we are surrounded by two states in our region where the infection rates have been very high, Wisconsin and Iowa. So when you look at our region in that contiguous area, people move across the borders fluidly, and I think that as each state, this has been part of that drive about, what you do in one state. You can't wall off your county, you can't wall off your city, you can't wall off your state. But that's why we all have to behave responsibly. This is not the time to travel to a long weekend, getaway to look at the leaves in Wisconsin or visit the bridges in Iowa. Because non-essential travel, and we are beginning to, continue through. We are really trying to make it through a pandemic, and I know we wish it wasn't there. And I know that, wishing doesn't make it so. We have to work toward keeping that down. And so we will continue to monitor. They put the first tier mitigations in, and our infection rate did not go down. It went up. And as we go through, I come back as I have more and more having a hard time adhering to the mitigations, and the infection rate continues to climb. So I think that that's a pretty clear indication that we are going to have to really work hard to get ourselves down to 6.5. Anything else? Thank you, get out the vote, and have a great day.
You got 5 minutes?
Let's tell you the time. Yes.
One of our reporters asked about some city council stuff. Can I get 4 questions into you quickly?
Yeah, I think I'm